Hey, I just wanted to make this video to kind of raise awareness of the disease I was diagnosed with, which is Lyme disease. And I've probably been fighting it now for like at least the last 6 months. I was diagnosed 3 weeks ago and I begin treatment today, which will most likely be at least 6 months of antibiotics among 30 or 40 other pills that I'm going to take. Uh, you know, when I originally found out I was diagnosed with Lyme's, I was ecstatic. I was very happy because at the point I was at, I had come to the conclusion at least that it was cancer. There was nothing else to explain what I was going through. So when the doctor came back and said, "You're negative for cancer, you're positive for Lyme," I was pretty happy. When I went home that night, I started to research and look into it, and I suddenly realized that this isn't such a quick fix that I would thought it would be. The article that has stuck in my head the most that I came across was this woman that in her life she's suffered both late stage cancer and late stage Lyme disease, and she said if she had to go over and do it again, that she would do the late stage cancer treatment every single time over going through late stage Lyme treatment. Now, I'm not here to say what is worse, Lyme disease or cancer. It's kind of a moot point. I mean, really, everyone suffers, and it'd be great if neither existed in the world, but that's not how it is. It put things in perspective for me that you go, okay, this is this is a long road. Um, I really have to fight these next few months. Um, I'm not going to wake up one day into tomorrow or the next day and just be okay. It's a long process. Now, I asked myself, is this that rare? Why have I never heard about it? Uh, the fact is that there are 40,000 cases of Lyme reported every year by the Center for Disease Control, but even they admit that that stat is inaccurate. Uh, 500,000 people are diagnosed with Lyme every single year. That's 10 times more than AIDS, SARS, swine flu, and West Nile virus combined, yet you never hear about it. The medical community doesn't really acknowledge that we exist. Um, the insurance companies would lose billions of dollars if everyone with this condition was treated. So it often goes misdiagnosed, or the people are told, a couple of doctors told me it was in my head, and this is something we all go through. So it's a scary time to say the least. In 6 months, I don't want to wake up and not be able to remember my name or who my family is or any of that. The number one cause of death among Lyme patients is suicide. The disease is so debilitating that it actually pushes people to take their own lives because they see no other way out. Uh, the pain. I don't want to go into and talk about what I've had to go through. I mean, this really isn't about me. This is about raising awareness so someone down the line doesn't have to endure what I had to suffer. But the pain is unlike anything else. It is so excruciating. And the fact that this disease not only attacks your body, I mean, people lose the ability to walk, or they can't no longer can move their arms or hands, or all of that stuff, or they get really, really bad arthritis, but it also affects your mind. So, I mean, in my mind, in my eyes, I can't think of a condition that just attacks your body and debilitates you more than this thing possibly could. It attacks your body and it attacks your mind. Now, the only thing is, this is such a preventable disease. If caught early, it is very easily treated. The fact of the matter is, it is rarely caught early and usually develops into much worse. There's been many reports that say this goes on to lead to multiple sclerosis, Alzheimer's, Lou Gehrig's disease, Parkinson's. You know, there's some rumors out there that Michael J. Fox had Lyme's disease before his Parkinson's developed. I'm not here to speculate on that. That's not what this is about. Um, the fact of the matter is, people um, need to get diagnosed and get the proper treatment. the test that is used to diagnose Lyme disease is inaccurate more than 50% of the time. I tested negative a few months back for Lyme, so it was ruled out until one doctor finally came in and said, no, 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 those tests are inaccurate. Let me put it this way. Let's say an HIV patient goes to get tested and they test negative, and they come back 6 months later and they say, hey, I'm still really sick, what's wrong with me? And they say, oh, well, now you have AIDS. That test we gave you isn't even that accurate. Sorry. That's what Lyme patients go through every day. You know, if I was diagnosed earlier, this would have been would have been treated at least much more easily than it is now. And the symptoms I've had to suffer could have been largely prevented. But we're given a test that more often than not is wrong. And then amongst that, even once we're diagnosed, we don't get the proper treatment. Insurance companies don't cover our treatment because they stand to lose billions of dollars if they acknowledge that we exist and if they were to cover all of our treatments. The doctors that are in charge of, the Infectious Disease Society of America, or whatever, the board of those people, I'm not speaking formally, I'm sorry, but half of the panel that decides what the protocol is to treat Lyme, or if chronic Lyme exists, half of them have conflicts of interest and are tied into insurance companies, pharmaceuticals, patents. They stand to profit by basically saying that this doesn't exist and that we should not be provided with the treatment that we need. This needs to change. Look, I'm a hypocrite because, before all this was going on, I was working in Africa and I was doing HIV/AIDS awareness. And, as a developed nation, we have provided all these programs and clinics for not even our own nation, but for underdeveloped countries, where anyone off the streets could get tested for HIV/AIDS or malaria and get diagnosed and get the medication we need. We've done so much to make sure that those people get the attention they need, and rightfully so. No one deserves to suffer. So I'm not against that. I went there and I did that, and I did awareness. But I would be a hypocrite if I didn't also raise awareness of the disease that I'm fighting. And we have hundreds of thousands of patients at home in our own country suffering and dying, and we're not doing anything about it. In fact, we're making it worse on them. And we can fix it. It's so easy. All we have to do is diagnose them and treat them right away, but people go undiagnosed for years, and then they get to that point where it's been too long. In the same kind of retrospect as HIV/AIDS, Lyme is like early stage, late stage. Once you get to that late stage, you're stuck. It's not treatable anymore. The system has to change. In North Carolina, on a health insurance forms, I believe it's North Carolina, they actually ask you if you have Lyme disease, yet if you do, they won't treat it. We don't exist, but yet you ask on a form whether we exist or not. The point of this video was to say that people need to know about Lyme disease. They need to know what it does. Okay? I've gone through pain and suffering these past 6 months that, it would take me hours to even describe, and I'm not even going to get into that. But I'm not even one of the bad cases. There are much worse than me. And these people need to be brought to light. Sadly, I'm not a celebrity. I'm a normal college student. I can only do so much. But people need to get the treatment they deserve, and we cannot continue to let hundreds of thousands of people we know suffer until they hit their demise. And I feel like, when I originally thought it was cancer, I just wanted to hide in my room and not tell anyone what was going on. And I still kind of feel that way with this, but I feel everyone who has this has a responsibility to come out and tell their story and what they've gone through. So I ask everyone who's been diagnosed with chronic Lyme, don't sit in your bed, don't sulk, don't cry. Go out there, let people know what's going on with you, so that, at least us, we might be able to get the treatment we deserve, and people down the line can get diagnosed right away and don't have to suffer. thank you for listening to my rant, and I hope to come out of this okay.